If you're over 60 and your knee starts complaining in those very first steps of the morning, this video is for you. Some people wake up and their knee already feels stiff, stuck, unstable, like the leg hasn't fully booted up yet. And sometimes it's not even a strong pain. It's that annoying tightness, that discomfort, that little fear of putting your weight down the wrong way, and it changes how your whole day starts. A lot of people assume that's just normal for your age, and they get up anyway, on impulse. But that's exactly the mistake that irritates the knee the most, putting weight on a joint that's still cold and stiff. Today, I'm going to show you what you need to do before you get out of bed. A simple, safe, quick sequence with 3 stretches and 2 mobility exercises you can do lying down before standing up. It's designed to help loosen the leg, wake up the knee more gently, and give you more confidence in those first steps of the day. And the best part, you don't need fancy equipment, strength, or a lot of time. In just a few minutes, you'll prep your body to get up more safely. As a physical therapist, I see this all the time. Someone wakes up, tries to get up quickly, and the knee feels stiff and painful in the first few steps. And often it improves once they start moving. That happens because, overnight, your body stays still for hours. The joint gets stiffer, the tissues around it lose some of that temporary looseness, and the muscles that help protect the knee, especially the thigh and hip, aren't fully activated yet. When you jump up right away, the knee takes load before it's ready. That feeling isn't all in your head. And there's one important detail I always repeat in the clinic. The knee doesn't work alone. If your hip is stiff and the back of your leg is tight, your knee compensates. So the smartest strategy isn't just move the knee, but to prepare the whole leg with gentle, safe stretches and movements before standing. Tell me in the comments, does your knee bother you more in the morning? And do you usually stretch before getting up or not? That helps me understand you better and how I can help. Now let's get to the good part. What you can do still in bed so your knee thanks you the rest of the day. Before we start, a quick note. This routine is for people who wake up with knee stiffness or mild to moderate discomfort, and it's meant as educational content to help prepare the joint before standing. It doesn't replace a medical or physical therapy evaluation. The goal is not to force anything or feel sharp pain. During the movements, you should feel relief and a stretch. This is a safe, practical sequence I've found helps my patients start the day with more control and confidence. Stretch 1. Let's start with the first stretch for the back of the thigh, hamstrings. I like starting here because when this area is really tight, the knee often feels worse first thing in the morning, and the leg can feel stuck, heavy, and stiff when bending and straightening. Lie on your back, lift one leg, and hold behind the thigh. Don't pull directly on the knee. If it's more comfortable, you can use a towel or a strap around your foot to help. You don't need to fully straighten the leg. You can keep the knee slightly bent, especially if you're very stiff. Now gently pull until you feel a stretch behind the thigh. It should feel like mild to moderate tension, not pain. Hold for about 20 to 30 seconds, breathing normally, no holding your breath. Then relax and repeat one more time on that side. After that, switch legs. This stretch helps loosen the back of the leg and reduces that resistance many people feel in the first morning movements. And that matters because when the hamstrings are less tight, the knee usually moves more comfortably. Stretch 2. Now for the second stretch, which is excellent for loosening the outside of the leg and the hip, an area many people don't stretch, but that can strongly affect the knee, especially when you stand up and start walking. Lie on your back, place a towel or strap around the foot of one leg, and lift that leg carefully. The other leg can stay extended and relaxed on the bed. From there, move the raised leg slightly diagonally across your body, toward the opposite side, like I showed. The key is to keep your shoulders down and avoid twisting your torso. You don't need to cross very far. It's a small, controlled movement, just until you feel a stretch along the outside of the leg or the side of the hip. If you feel too much behind the knee, bend the knee a bit to reduce tension. Hold for 20 to 30 seconds, breathe calmly, then return slowly. Do it 1 to 2 times on each side. This stretch is really helpful because it loosens the lateral chain, which, when stiff, can change how the knee takes load. And when you improve that mobility early in the morning, your body usually stands up more comfortably with less compensation. Stretch 3. Now let's go to the third stretch, which targets the glutes and the back of the hip. This one is really important because a lot of people focus only on the knee, but a stiff hip changes how your leg moves and the knee ends up compensating. Lying on your back, cross one ankle over the opposite knee, making a 4 shape. If it feels comfortable, thread your hands behind the thigh of the bottom leg and gently pull it toward your chest. If you can't reach, you can simply hold the 4 position. You'll still feel it working. Keep the movement gentle. You should feel a stretch in the glute and hip area without forcing the knee. Hold for 20 to 30 seconds, breathing calmly, then switch sides. Do 1 to 2 rounds on each side. This stretch helps a lot if you wake up with your leg feeling heavy or with that stiffness that hits the hip and knee at the same time. And it sets you up perfectly for the next step. Mobility work to fully wake up the knee. Exercise 4. Now that we've loosened the leg with stretches, let's start knee mobility. The first move is simple and super effective, sliding your heel on the bed. Lying down with the leg relaxed, slide your heel toward your butt, slowly bending the knee, then extend it back out to the starting position. Do it in a controlled way, no rushing, like you're gently waking up the joint. You don't need to force the range of motion. If your knee feels stiffer today, make the movement smaller. The most important thing is that it stays comfortable and smooth. The goal here isn't intensity, it's mobility. Do 8 to 12 reps on one leg, then repeat on the other. This exercise is great for reducing that locked-up knee feeling in the morning because it gets the joint moving lightly. No impact, no weight bearing. It's basically prepping your knee for what comes next. Sitting up, putting your feet on the floor, and standing with more confidence. Topic 8. Mobility 2. Active knee flexion and extension. Now for the second mobility exercise, which starts waking up a bit more leg control, especially the front of the thigh, which is a key muscle group for protecting the knee when you stand up. Still lying down, lift one leg slightly off the bed, just a little, and slowly bend and straighten the knee. Keep the movement short and controlled. You don't need to lift the leg high, and you don't need to force full extension if your knee is stiffer today. Do 8 to 10 reps on one side, then switch. As you do it, focus on smooth movement and control, not effort. If you feel mild discomfort, that's okay. If you feel sharp pain, reduce the range or pause. This exercise is great because it improves mobility and gently activates the thigh muscles. That makes a big difference when you stand up because the knee feels more awake, more stable, and more in control to handle your body weight. Now here's a very important part. It doesn't help to do the routine in bed and then stand up on impulse. How you get up matters for whether your knee will thank you or complain. Instead of sitting straight up and popping up forward, first roll onto your side. Then use your arm to support yourself and push up until you're sitting on the edge of the bed, slowly. Once you're sitting, don't stand immediately. Stay there for a few seconds. Place both feet firmly on the floor and let your body register the position change. This is especially important if you feel dizziness, weakness, or instability when you wake up. To stand, lean your torso slightly forward and push through your feet, standing up with control. If you need to, use your hands on the bed or a stable surface nearby. The most common mistake is standing up quickly in a rush, and then the knee locks up on that first step. When you transition slowly, you get the full benefit of what you just did. The stretches reduce stiffness, the mobility work woke up the joint, and now your knee takes your body weight much more prepared. If this kind of content helps you, subscribe to the channel and turn on notifications, because here on Physio Tips, I always share simple, safe, practical exercises and stretches for everyday life, especially for anyone who wants less pain, more mobility, and more confidence moving around. But if your knee pain is already getting in the way of your routine and you want a more complete path than random standalone videos, click the link in the pinned comment and check out Knee Pain Relief Codes. There, you'll find a more structured at-home plan for knee relief and care, and you can also book a free 15-minute consultation to better understand how it works. And remember, after 60, the goal isn't to do everything perfectly. It's consistency with simple movements that actually help in real life. Even a short routine like this, done calmly and regularly, can make a big difference in how you get out of bed, walk around the house, and start your day with more safety and confidence. If this video helped you, tell me in the comments which part of your morning is hardest on your knee: getting out of bed, starting to walk, or climbing stairs, because I can plan the next videos around exactly those situations. In the next video, I'll show you knee pain when climbing stairs, 3 strength exercises that don't irritate it, a simple, safe sequence to strengthen your legs, protect your knee, and help you feel more confident going upstairs without fear. See you there.